As a pediatric ENT, I see so many patients that are having difficulty getting pregnant or have had a baby and it took a long time to get them. And this is an interesting study that correlates air pollution and your ability to have a baby. Hi, I'm Dr. Stephen Gowdy, pediatric ear, nose, and throat surgeon and inventor of the NoseBot. So this study here demonstrates the correlation between air pollution exposure and oocyte donors as well as male recipients related to fertilization and embryo quality. So there's growing interest in the reprotoxic effects of environmental exposures, air pollution, and how people are having issues with oocyte production, impaired semen parameters, as well as ability to get pregnant in areas that have higher air pollution. So there is a known correlation between higher air pollution exposure and impaired semen parameters, including higher sperm DNA fragmentation, aneuploidy, which just means the DNA isn't matched or symmetric, lower sperm morphology, motility, and altered productive hormone levels. There's also a correlation of air pollution and compromised female reproductive potential through enhancing follicular atresia, meaning they're not growing, leading to lower ovarian reserves, aberrant menstrual cycles, and lower ability to get pregnant. And what are these things in the environment that we need to be aware of? So it's ambient air pollution, literally thinking about carbon monoxide, ozone, fine particulate, coarse particulate matter, nitrogen dioxide, sulfur dioxide, and many other things. And really, these are potentially harmful to your body before trying to get pregnant and to your eggs and your sperm when you're trying to get pregnant, which is really time sensitive in that a small study in Oregon showed an acute exposure to wildfire smoke during IVF was associated with lower numbers of oocytes, which are the eggs, as well as blastocysts that were created. Also, interestingly, in this study, they identified the site of where the in vitro fertilization occurring and the sterility or the purity of the air or the number of pollutants in the air did correlate with the ability to fertilize the eggs. In this study, they found a strong correlation between carbon monoxide and several other chemicals, as well as fine particulate matter and organic carbons, were the most likely to be affecting folliculogenesis and spermatogenesis. Again, here are the folliculogenesis and spermatogenesis and the different compounds that are harmful in the environment that could impact your ability to be fertile. So in this study particularly, they were studying oocyte donors as well as recipient male sperm, and they found that higher ambient exposure to organic carbons during folliculogenesis, ovarian stimulation, spermatogenesis, and on the day of oocyte thaw was associated with poor oocyte, meaning the egg, survival, fertilization, and embryo outcomes, and additionally higher exposure to these fine particulates during ovarian stimulation and the larger particulates during folliculogenesis was associated with lower portion of oocyte. So all that's to say the environment matters. The folks that are struggling to have babies should be aware that environmental pollutants can impact this. And as a couple, you need to control, mitigate that to the best of your ability and be aware of the studies that are ongoing to help protect you and our environment and our children.